Team, you can start.
Om Dhanvantare Namaha.
Shri Gurubhyo Namaha. Namaste and warm welcome to this refreshing evening session. I am Dr. Meghanatti and I wish you all happy Yugadi. Just like changing ritus, Yugadi marks a new beginning. Let's embrace this change with an open heart, mind, and spirit. May our Ayurveda's wisdom guide us towards a healthier and happier us. It's my privilege to host today's session organized by Team Ayuryana. With due regards and consideration, I bow down to all revered gurus and esteemed guests, organizers, and our passionate audience. Now, I would like to introduce about our team Ayuryana. Ayuryana webinar series on Ayurveda practice is a free webinar series conducting on every week for an hour with the motto of empowering the Ayurveda fraternity to excel in clinical practice and sustainable in Ayurveda entrepreneurship. Its initiatives and aims includes informative articles and health tips, health-focused campus and events, recreational activities and exertion for students, individuals with physical challenges, seniors and general public. Sustainable tourism programs such as ecotourism and agritourism. Ayurveda proudly blend tradition with innovation, events, and activities, which will incorporate traditional practice, local cuisines, and rural games. Ayuryana, inspired by a timeless principle of Ayurveda, thread moral, cultural, and traditional values into every experience, creating a very rich tapestry of heritage and illness. Now, Now I request Dr. Jaikumar sir, who is pursuing PG in Rachana Sharira AME Hubli, to host a session and introduce about a guest speaker.
Thank you, Dr. Meghna. It's my privilege and honor to introduce our today's guest, Dr. Kasturi Rangan BS sir. Dr. Kasturi Rangan sir is an Ayurveda physician, researcher, and educator. Sir has completed his BMS from SDM College of Ayurveda, Udupi, and post-graduation in Rasashastra and Vaishyaja Kalpana from SDM College of Ayurveda, Udupi. Sir is currently practicing as an Ayurveda consultant at Shatayu Ayurveda, Bengaluru. Through his continuous efforts and enthusiasm in the field of Ayurveda, Sir has secured several national and international recognition, including Best Oral Paper Presentation Award at International Conference of Ayurveda Pharmaceutical Sciences 2023, organized by National Institute of Ayurveda, Jaipur. Sir has secured first prize and gold medal in the Dr. Ganga Saheb Pandey Memorial All India Essay Competition 2018 by organized by Vishwa Ayurveda Parishad and Banaras Hindu University, Varanasi. Sir has secured Best Oral Paper Presenter Award at Alvas Vedanga 2023, Jignasa Achintya Ayurveda May 2023, and Pariksha Anveshana 2023. Sir has presented in about 9 prestigious seminars and conferences across India and has published 7 scientific papers in reputed journals. Sir holds university rank in Roganidana, Rajiv Gandhi University Health Science. Apart from this, Sir has secured first prize in Karnataka in the Swachh Bharat Summer Internship 2018, representing Udupi district and winning cash prize and accolades for SDM Udupi. Despite his accomplishments, he remains as a dedicated student of Ayurveda, striving to blend classical wisdom with contemporary research for the betterment of healthcare. Alongside his academics and clinical pursuits, he is also trained Carnatic violinist and yoga practitioner, reflecting his deep connection with Indian classical sciences. Today, we are looking forward to have him as a speaker on the topic Insights in Ayurveda Clinical Practice, Analyzing Classical Yogas. Let us extend a warm welcome to Dr. Kasturi Rangan BS sir. I request audience to drop your doubts on chat box. Sir will classify the doubts at the end of the session. Let's embark on this journey together, exploring the ancient wisdom of Ayurveda on its relevance in modern science. I once again welcome you, sir. The mic is to you, sir.
Kasturi sir, you are not audible. Kasturi sir, you are not audible.
Am I audible?
Huh, yes.
Yes, sir.
Sir, please share your screen, sir.
Yes, yes, sure. Okay. Now, is the slide visible and am I audible?
Yes, sir.
Yes,
Okay,
sir.
okay, okay.
Yes, sir.
Okay. Let us begin. Sorry for the delay. Some connectivity issues. Okay. Um, Let me begin. Okay, let me begin with a small invocation to the Shwini Devatas and all the physicians, the our ancestors and our teachers and everyone by this invocation. Om Shri Guru Bhyo Namaha. Okay. Okay. Coming to the topic proper. The slides are changing, right?
No, sir.
Slides are changing.
No, sir. Sir. Now change.
Okay. Now slides are changing, right?
Yes.
Yes, sir.
Okay. Okay. Coming to the topic proper. Now, we all know about the utility and the scope of Ayurveda in terms of Swastasya Swasthya Rakshana and Aturasya Vikara Prashamana. So, let us deal with the Vikara Prashamana aspect of Ayurveda, keeping aside Swastha Vrutta and Swastha Paripalana for this session. Okay. So, when we come to Vikara Prashamana, so it again is divided, or we can segregate the treatment into the two aspects, that is the Vyadhi Vinishchaya and the Chikitsa Bhaga. So under Vyadhi Vinishchaya, what all comes or what all we have to work upon is in analyzing the Lakshanas, the manifestations with which a person, our patient or the health seeker comes to us. The Lakshanas, then the Nidanas, then with that Lakshanas, we have to question with various parikshas, and with our questioning, we have to make sure of the Nidana, map the Samprapti, and then get a hold of the Kriya Kala at the stage of the illness that which the person is at present. And then we have to make a detailed analysis of the Roga and Rogi Pariksha. This, while this forms one part, the other part is the Chikitsa, that is the our intervention as such. So this includes the Chikitsa Siddhanta, the application of the treatment principles as enumerated by the Acharyas. And also we can also incorporate our own Siddhantas, given that we analyze the dosha, dushya and other bhavas, and then frame our own chikitsa modalities to bring back the dhatu samya avastha. Along with that, the after the framework of the chikitsa, the pattern that we have to treat, what the next step would be is the dravya pariksha and dravya samyojana. So nowadays we don't do the dravya pariksha as such because we have a ready-made medicines, but still this is very important to know the efficacy of a medicine that we prescribe. We need to know what ingredients the drug has, the formulation has, how it is prepared, and these basic aspects has to be analyzed at some stage or the other. And then comes the karma and kramas. So this includes all the panchakarma or the other modalities of treatment, bahya upacharas, etc. And kramas would include all the patya patya paripalanas, achara vichara, etc. So all these comes under the chikitsa bhaga. So as forementioned, the two aspects, I would be dealing with the chikitsa portion with respect to the formulations in this seminar. So let me begin with some insights in Ayurveda practice at general. So simply prescribing Ayurvedic medicines or therapies, will it help? Definitely not. So then what should we do? That is the next question. So for that, we need to do a thorough diagnosis, and then the assessment of the dosha, dushyas, etc. and other bhavas, and then framing of the chikitsa kramas using Ayurveda principles, and then finally incorporating the proper dravya, or else using available dravya and adravya bhuta chikitsas to the best possible level that we can. And again incorporating the karmas, panchakarmas, etc., various other modalities as and when required. And treatment doesn't stop here. We have to educate the patients about the patya patya, which is very important. And foremost, we can say nidana parivarjana is the most important thing. You might ask that why is nidana parivarjana coming at the bottom? It should have been at the front. See, that is nidana parivarjana is the foremost modality of treatment, but still whenever, from my own experience of whatever clinical practice I have done so far, so when a patient comes to us, we have to analyze the nidana, but most of the times conveying the same to the patient and asking for nidana parivarjana, advising too much related to the swastha vritta, sadvritta, etc., nidana parivarjana aspect of it, patya patya alone, in the beginning, the patient would not find our practice trustworthy or sustainable. So we have to give some intervention. It could be a single herb or some formulation, simple formulation, or any other modality of treatment to gain the trust and confidence of the patient initially. And then later on, we can taper off even our medications and advise about nidana parivarjana, sadvritta, etc., which will be the only thing that will sustain in the long run. Okay, so this is something very general. So let me go on further. Let me take an example. So see, as I told you, simply prescribing Ayurvedic medicines as in, okay, this medicine is for this disease, this vyadhi adhikara, this medicine has been told, so let me use it. So simply prescribing medicines in that fashion, will it help? Maybe sometimes it will be helpful, but obviously it will not run in the in all the patients, because it is flawed from the beginning itself. We have to make an assessment, we have to map out the samprapti, and then only use the proper drug. Otherwise, simply prescribing a medicine based on the rogadikara, like just like giving paracetamol in fever, is not going to help. Okay. We have to know how it works, how the medicine works, and then proper select the proper medicine, and planning has to be done. So if I were to give an example, in fever we use paracetamol, that is acetaminophen, so which happens to be a prostaglandin inhibitor, and it has an analgesic antipyretic effect. So this is how the paracetamol is going to act in most common type of fevers. But what is actually the drug doing to the body? This very seldom people overlook, and it is almost taken as a notice. People want something that to bring down their fever. So will such a similar framework work in Ayurveda? In case if we were to correlate to as jvara, so there are certain drugs, medicines, Ayurvedic herbs and formulations which are said to be jvaragna drugs. Will these help in all type of fevers? No, definitely not. Then there are certain medicines which are branded as immune boosting. So will this help in general public usage? Maybe not. It could also be harmful in certain cases. And there are some herbs labeled as antibacterial, antiviral. So do they actually do antibacterial activity? Maybe not. It works. Ayurvedic drugs work on the doshas and dhatus. When the dhatus and doshas return to normalcy, balancing the doshas happens, then an antibacterial effect may be achieved. But the Ayurveda drug may not actually go inside the body and kill the bacteria, which is often misunderstood by the public and even Ayurvedic students. So this has to be avoided. So what is the way forward? We have to know the nidanas, at least the map the nidana panchaka from the lakshanas, then go for the dosha dusha assessment. Vyadi, we have to understand the vyadi. Then along with the aushadha and patya, only then we can treat any condition. Coming to the Bheshada spectrum. So how do we treat? See, there is a varied practice. If we were to see the leading practitioners, Ayurveda practitioners, their practice is quite different from one another. Okay, and not only their style of practice, we have multiple options itself. If we were to see in our own samhita, we have in Charaka Samhita, we have the you know Dashemanis, we have the Gana Sangraha Dravyas, then we have single herbs and simple herb combinations. If we were to see any Chikitsa Sthana Adhyaya, so firstly they will give the Lakshana, Samprapti, etc. features of the Vyadi, then they will give few simpler combinations of herbs, kashayas, churnas, etc. And then they will go on to explaining the yogas indicated, the formulations. So this is the pattern that is seen in the samhitas, and it is for a particular reason. So as I said, so this is an inverted funnel approach that I could have thought about seeing the practice of my gurus. So actually, when we set out, when we begin as practitioners, we usually begin with multiple complex formulations, because we are not sure, we may not be sure, in most of the times, to be on the safer side, we prescribe formulations saying its efficacy. So that is a very safe way to approach the chikitsa. As and when we become mature with experience and clinical expertise, pinpoint diagnosis, okay, so we may reduce the formulations. With still more expertise, we come to simpler formulations, not big formulations with 30 to 40 drugs. We come to simple formulations, reduce the number of formulations that we use, and then probably with even more mature practice, we may also use multiple herb combinations like ganadravyas, etc. And also the most ideal way would be to just give a simple herb to correct the imbalance. So always this happens, this hierarchy is one thing, it depends upon the experience and the expertise, and the other thing is depending on the type of illness that a person is having based on the complexity or the severity of the condition, this funnel approach has to be incorporated. So moving on to the framework of a formulation that we select. So if we were to analyze the framework of a formulation, there are some drugs in the yogas which we can identify as pradhana dravyas. So they would be vyadi praktanika or the samprapti bhedaka drugs that we can call. For example, if we were to take sitopaladi churna, in sitopaladi churna we know it has many ingredients, but we could identify pippali as one of the main ingredient which stands and which holds the yoga in its action in kasa shwasa, etc. Okay. And then we have something called as biocatalysts, or in other words, they are the drugs which will enhance the activity of the other ingredients. It could be trikatu, triphala, etc. So if we were to take any compound formulation, almost all the formulations will be having trikatu, triphala, trimada, etc., dashamula, so many drugs in small quantities. I am not talking about using trikatu itself as a drug, okay, or nor triphala itself. But triphala and trikatu have been added or incorporated into many yogas in smaller proportions. So they act as biocatalysts, making the action of the main dravya very easy. Okay, so that is their action. So that is how a yoga has to be understood. We'll deal with this. And then there is another group of drugs which we can understand as synergistic, drugs. For example, it could be kajjali, it could be lavana dravyas, it could be madhu, grita, or even certain rasa dravyas like abraka, basma, etc. So they act as synergistic drugs because when these ingredients are incorporated into any formulation, usually they will also be having some action, but they will also amplify the action or the activity of the other drugs. Kajjali no doubt is having a therapeutic action. Grita itself is having some action. Abraka basma is definitely having action. Lavanas, they also have some action on their own, but when they are incorporated into the formulations, they contribute and they enhance the activity. Okay, so added advantage would be there. All these dravyas are, we can say that they have the yogavahi property by which they act as synergistic agents. And moving on to the next aspect, how to understand the yoga. So there are also some drugs which are antagonistic, that is incorporated in a yoga. Antagonistic in the sense which are of opposite qualities or opposite activities. You may say, why do we need opposite activities? Working dravyas working against each other. That is because, see, many a times the vyadi will be tridoshaja or sannipataja in nature, and we formulate a yoga so that it addresses the wide spectrum of these sannipataja conditions. And if we were to only use single herb, it would act on vata, for example, or pitta, or some particular guna of vata, etc. Likewise, when we use a yoga, it would be acting on multiple doshas, multiple gunas, etc. And in the same way, if there is any activity unwanted, or when we use the yoga for a longer duration of time, any adverse reaction that may happen due to the components, they have to be nullified. So for example, in kutajarishta, okay, kutajarishta commonly used in atisara conditions, kutaja is a sthammana dravya. Okay, so in this, draksha is also in a major proportion. Draksha is incorporated in the next proportion. So maximum quantity of kutajarishta it has is kutaja, and the next drug is of draksha. About 20%, 30% of the formulation is draksha. So if used for a longer time, for example in grahani conditions, so if kutajarishta is used, so there may come a phase when kutaja would be causing stambhana, and it would lead to excessive dosha, prakopa due to stambhana activity. At that time, to ensure that the dosha, dhatu, mala are in samyavastha, there also needs to be some amount of, anulomana activity. Some balance has to be there. So for creating that balance, there is a presence of antagonistic drugs incorporated into the yoga itself. So Kutaja is doing stambhana, about 60 to 70% stambhana, and along with that about 30% of anulomana is also happening, so that we get a balanced approach. This is one of the unique feature of yogas. Okay, so moving on to the next set of drugs that are in a formulation, that would be the antidote drugs. So our acharyas, while formulating many yogas, they naturally have given thought of almost all the adverse reactions or complications or unnecessary incidents that could arise due to the prolonged usage of a yoga. So they've also incorporated the antidotes, the antagonistic drugs, etc. This set of drugs also have been used in the yogas. Example would be Vatsanaba, that is whenever Vatsanaba is used in a formulations, almost 90% of the times, not compulsorily, almost all of the times, Tankana is also incorporated. So Tankana is also having its own set of pharmacological properties. It has its prabhava, karma, etc. But the most common advantage would be that it is a antidote. It is the prativisha sort of a thing for Vatsanaba. So Vatsanaba used for a long duration would be causing certain set of complications. To tackle that, Tankana is being also incorporated at the same time in the yoga to make the yoga more balanced. So this is how yogas have been formed. Along with that, we have to analyze various samskaras like bhavana, avartanas. So avartita tailas we have various even pakas of taila, mrudu paka, madhyama paka, karapaka, so on. So all these bhavanas, various types of other samskaras, kala samskara is there. So all these samskaras give certain unique property to the yoga. So these also has to be understood. Then coming to the next very important thing is the Aushadha Kalpana itself. So we have various range of Kalpanas. Sneha Kalpana, Sandana Kalpana, Churna, Kashaya, Leha, etc. So many are there. So just to give you a common example, we have Ashwagandha Grita, we have Ashwagandha Taila, we have Ashwagandha Arishta, we have Ashwagandha Churna. So the drug, the main component, even though it is Ashwagandha, the way that it is being administered differs. So with this difference, it makes a lot of changes in the person using it, because the vehicle or the formulation in which it is being incorporated will give its own unique properties. Okay, so Sandhana Kalpanas usually are Ushna and Tikshna. Vyavayi Guna, it would be having Vyavayi Vikasi Gunas added with that, and it has a longer shelf life. So Ashwagandha would be getting these extra gunas. And Churna Kalpanas are quick acting, and they are usually Lagu and Ruksha in their characteristics. So whenever we are using drugs which are more guru and snigdha, Churna could be balancing. Likewise Kashaya is more Ushna, okay, and also very Lagu, and it has special action on Agni without hampering the Pitta. Sneha again, it also is Pitta Vardhana, Vatahara especially. So, and again, apart from these, if we were to see how the processing would be different, so suppose we boil the Ashwagandha in water, so only the components, the constituents of the dravya, that is Ashwagandha, which are absorbable in water. So in modern scientific terms, we would be calling that as water soluble components. So only they will be getting extracted into the Ashwagandha, and then we filter it off. We filter the Kvata Dravya off, right? So only the water soluble components come into the Kashaya. In Sneha, the lipid soluble or the oil or the fat soluble components would be coming into the medicine. And in Sandhana, we would be having a totally different set of components. Hydroalcoholic extract, we call that as. So water soluble as well as the alcohol soluble extracts would be getting into the Aushadha, that is the Arishta, Asava, etc. So these components itself will be differing. So their indication would be changing, their wide range of utility would be changing. So these are all some of the aspects that we need to keenly observe when we are prescribing medicines. What form, how much dosage, what duration, all these things again. So matra, kala, and prayoga marga, these are all the various things that we have to analyze and understand when we are in clinical practice. So how do we select a formulation? As I just briefed, so a selection of formulation is again based on the nature of the vyadi and the rogi as well. That is the main thing that we cannot ignore. Apart from that, the main ingredient that we want to use in a particular vyadi, that should be present in the formulation. The proportion and the concentration of the ingredient in the yoga, that is also important. Suppose we want a particular dravya, so we are giving it in the kashaya form, but if the kashaya has a lot of ingredients, the main ingredient that we have in our mind, that itself the proportion or the concentration is very less. So then we need to use the aushadha for a long duration for to get that desired output. So the proportion, the ratio with in which the drug is present in the yoga, that is also very important. And again, as I told you, the form of the kalpana itself plays a main role. Other components definitely has uh, significance. Apart from that, the quality of the medicine that we are using, so that that will come by understanding various pharmacy, how they manufacture, and again by practice, by seeing the results. Availability, shelf life also matters. And apart from that, one of the most important thing would be the cost and affordability to the patients. So this also plays a major role. So suppose we want to give a formulation, say Sutashekhara rasa. So there is Swarna Yukta and without Swarna. So variants are present. So seeing the indication. So if the patient demands that we use Swarna Yukta formulation, it's well and good. We can prescribe it, but again, before prescribing, we have to see whether it is sustainable and it is cost effective and affordable by the patient. That is very important. So many times, due to the affordability and even the availability of the raw materials and processing techniques, the yogas, we have to select the yogas based on all of these factors. So let me give you examples which will make it more clearer to you. So here I've selected few of the yogas which I use very frequently in my clinical practice for a wide range of diseases, and I have observed the changes, and hence I can speak from authority and experience. So going on into these insights of few formulations, firstly would be Mrutyujyaya rasa. So we know that very commonly it is given in jwaras. So analyzing the main ingredients, it has Vatsanaba, and as I told you, Tankana is present. Apart from that, it has Pippali, Maricha, Gandhaka, Parada, or Hingula. So again, one thing that we must know here is Mrutyunjaya Rasa comes in two variants. That is, one is made with Hingula and the other is made with Parada. So the one that is made with Parada and Gandhaka in the Kajali form would be black in color. So Mrutyunjaya Rasa, one variety is black in color, the tablet itself, and the other variety would be reddish brown in color. So the reddish one variety would be Hingula Yukta Mrutyunjaya Rasa. So at the outside, even though both of these formulations are for Jvara, there are minor differences in their utility. So Hingula Yukta Mrityunjaya Rasa would be more of Pachana activity, Deepana Pachana activity, whereas Parada Yukta would be more of it acts on systemic features, I would say. Like systemic Daha, Santapa, etc. Okay, so this is just a percentage variation, but generally almost both of these variants are effective in Jvara. Okay, and should this formulation be limited to Jvara alone? No. In clinical practice, I often use it in many of the rasa pradoshas of vyadis for amapachana in many of the chronic conditions as well. So in amavata, in any amaja conditions, when we need that sustained amapachana activity, so this can be used. So one thing that we need to note also again is the dosage. So we usually give one tablet which is about 150 mg, 125 mg or 250 mgs, once or twice a day, or thrice a day dosage. So that is normally okay. What the text says, तीव्र ज्वरे महाघोरे पुरुषे यौवनान्विते रक्तवर्णे
Sir, you are not audible.
Okay, am I audible, right? I'll continue.
Huh, yeah. Huh.
So as I was saying, so we need to analyze what the information has been told in the text and not just follow something that we have seen in general practice. So Mrutyunjaya Rasa, even though it is told in generally in Jwara, so we can use it in any conditions with in which we need the Amapachana action in general. Along with that, so the Anupana has been told. That has to be, strictly adhered with, because the text says Anupana Prabhedena Nihanti Sakalan Gadan. So the Anupana has to be used. And in case there is, Pittaja conditions or Pitta Prakriti people who experience a burning sensation, then Sitam Dadyat Prayatnena Nari Kelambu Nirbhayam. So as been told. So there is no fear in the adverse reactions, because the text itself gives the antidote and the countermeasures that has to be employed. Okay, the next formulation that I would like to share would be is the Avipattikara churna. So Avipattikara name meaning. So we all generally use the Avipattikara churna, but do we understand the name, the naming behind this formulation whenever we use it? Avipattikara means, Vipatti means, it could be some trouble, or in this context, it is an illness. Okay, Vipatti is an illness, and Avipattikara. So the formulation that renders the person free from diseases. That is the, the meaning behind the naming of this formulations. And right to its meaning, this formulation is very useful in many of the clinical conditions. Okay, so this diagram, this chart, gives the overall outlook at the formulation, the proportion of the ingredients. So the blue color, so this proportion, whatever you see, so this is Trivrit. Okay, so this half of the yoga is Sharkara. Okay, so this much is Trivrit. Okay, and this is Lavanga. Okay, and all these small portions, these include, Trifala, Trikatu, all those things. Okay, so whenever we give Avipattikara, we need to know what it has. So this is, so leaving aside Sita, so we have to understand that Trivrut and the Lavanga are one of the main components of this yoga. So the main indication is Amla Pitta, whereas the other indications and clinical utility would be, it is the best dravya for Nitya Anulomana. So in pathologies where the koshta is affected and we need Nitya Anulomana, so this is a very safe formulation. In small dosage Nitya Anulomana, and in some sufficient higher dosage, we can also give Sadhyo Virechana as well with this formulation. And as it is a churna form, and this combination is ruksha kara, so this will induce lagu and ruksha gunas, so that we have to keep in mind on long term usage. So we have to give some sneha dravyas to counteract the ruksha guna that is induced in the patient. Apart from that, it is doing the dhatvagni man, it is going to increase the dhatvagni in any conditions, whereas where we have dhatvagni mandya along with, vibandha. So this Avipattikara churna is a very best drug of choice. So this is again, in the Falashruti it says prameha, etc. so on. Common other indications would be the pitta vrita vata conditions. So wherever there is pitta vrita vata symptoms, it could be daha, trishna, etc. So in prameha we see this karapadayoho daha. So in that Avipattikara is a common indication. And again, prameha, we see that it has, it is a illness where there is klera dhatu vriddhi. So in such a condition, Avipattikara, which does the rukshana, and also the Falashruti says the indication is vibandham mala mutra yoho. So this is not only vibandha with respect to mala, that is purisha mala, even the mutra mala. So vibandha with respect to mutra, it does the anuloma. This is a very excellent, we can observe this clinically. So whenever we give this to a patient or ourselves, somebody else is taking this, we can notice that there is, any obstruction or any difficulty with respect to urination, it gets resolved. So it increases the agni again. Pramehan vimshatim chaiva sarva durnama nashanam. So again, this is again one of the formulations that is effective in prameha, as the text says. Moving on to the next formulation, Ekangaveera rasa. So here the main ingredients would be like Kantaloha, Tishnaloha, Naga, Vanga, Tamra, and Abrakabasma. These ingredients have been given the bhana with Trifala, Nirgundi, Kupilu, Arka, Datura, Shigru, etc. Okay, so there is a various bhavana dravya medium that is incorporated with the bhasma and along with the herbal ingredients. So this Rogadikara or the general indication is Vatavyadi, that too in specific Pakshagata. Okay, so the other clinical indications would be any condition where there is Kaphavrata Vata. In general, in clinically observable features, we could correlate this to neurological deficit or neuropathies, where there is kind of a shifting pain along with altered sensation. Okay, so Pipilika, uh, the clinical feature where the person complains that there is a sensation like an ant crawling over the body. Okay, so that is the most common indication where Ekangaveera rasa would be very easily benefiting to the patient. So but apart from that, there are few issues that I would like to highlight here. Pharmaceutical analysis, why it is important? Because we need to ensure the purity and the genuinity. So this yoga has Kantaloha and Tikshnaloha, Naga, Vanga, Tamra, etc. So we need to see how pure the ingredient is, because the many of the pharmacies, they would be generally using only plain loha basma. So loha basma in the sense iron oxide, with some marana they would be using. But this yoga, whatever the clinical indications has been given, it will be achieved only when there is Kantaloha and Tishnaloha, two varieties have present in the body. Okay, so this is one of the
Again, you are not audible.
could accumulate in the body and would lead to certain conditions. Hence we need to ensure that the genuinity of the drug is of utmost importance here. And the very common complications would be the Naga and Vanga deposition. Again, so if we were to prescribe this along with certain other yogas, so which would be beneficial in tackling the adverse reactions, like you know Avipattikara churna, for example. So since uh, it is going to do the anulomana, in a way it is going to clear off the deposition of these basmas. So generally, if I were to prescribe Ekangaveera rasa along with that, Avipattikara churna would be a co-prescription. So it is also acting in the pitta vrata vata condition, and again it would help in the general indication as well, also act as an antidote and precautionary measure as well. Okay, so this is one of the drug. Again, moving on to Chandraprabha. Okay, so this is one of the formulation again which is seen in wide usage. So Chandraprabhavati, as the name says, on intake of this medicine, on usage of this medicine, the luster or the complexion of the person would be like moon. That is the moon-like appearance or the radiance. So in general, what this is telling is this would give the normal complexion. So this again is an inference that it acts on the kleda, the rasa, rakta, adi dhatus in the body. Okay, especially the mutravaha srotas. So then moving on to Chandraprabha, what exactly is Chandraprabha itself is sometimes a controversial topic. So generally it is considered as Karpura, but there are variants with small variations, to the interpretation of Chandraprabha name, that would be Bakuchi, Kachura, Shati, Shatavari. These are some of the ingredients that are also used by certain pharmacies. So, but the general accepted one is the Karpura, and nevertheless, this Chandraprabha is only the beginning, this first ingredient. So, among the 37, 38 ingredients, this is having a very less proportion. So whatever the drug is, it is in a very minute proportion, so not much of a concern here. Among the other drugs, we have the Trivrit, Danti, Trijata, Vamshalochana in 4 parts, that is in higher proportion, and again Loha Basma in 6 parts, and Shilajato and Guggulu in 32 parts. Okay, so again, this, if we analyze this, Shilajato and Guggulu form the main component of Chandraprabha vati along with the other ingredients. So what is the Adhikara here? The Adhikara is the Prameha. So in general, in conditions of Prameha, this drug can be given very safely. Apart from that, other indications would be the Dhatukshayaja conditions, Vata Vyadis, it could be Sandhigata Vata, and any condition with respect to Apana Vata. Okay, and also particular to the Mutra and Shukravaha Sroto Vikaras, and in generally as a Rasayana. So as a Rasayana drug, because this has Shilajato and Guggulu and few basmas like Loho Basma, Swarnamakshika Basma, etc. So this can be given in a lesser dose as a Rasayana Dravya in old age conditions. The Falashruti says Prameham Vimshatim Kritra Mutraghata. Okay, these are all the indications. Apart from that, Pumsam Shukragatan Doshan. So Shukragata doshas, and again Strinam Artavajam Rujam has been told. So this is very useful in Strinam Artavajam Rujam. That is the painful menstruation conditions. Okay, this has to be taken as a rasayana. Only then it would be correcting the apana vikriti and would be helpful. So this is not probably going to help in sudden relief of pain in painful menses. So this is from the clinical observations. So moving on to the next drug, we have Kaishora guggulu. Again, this is one of the most commonly used drug in my practice. So as you can see from this diagram, so I'll come from the most largest proportion. This the grayish portion is of guduchi, that is the amrita. Okay, then the next, this orange, this one is of the trifala. This is of guggulu. Okay, and this green portion is grita. Okay, and this one would be the Trivrudanti Vidanga. Okay, so these are the ingredients. The main drug, hence we know, is Guduchi. So this has to be known when we are using Kaishara Guggulu, so that we can also use this in many conditions. Instead of limiting Kaishara Guggulu to any particular Vyadi, if we know the ingredients, the ratio, proportion, we can definitely use this in wide range of illnesses, in conditions, since we know what it is made of and how much quantity the drugs are. So the main indication being Vatarakta, we know that in Agra Prakarana, Guduchi Vatasra Roge has been told. So Amrita or the Guduchi is one of the drugs mainly useful in Vatarakta conditions, not only Vatarakta Vyadhi here. So Vyadhi, it also acts as a Vyadhihara Rasayana in Rakta Vrita Vata conditions. So any Avarana of Vata, okay, in Rakta conditions, so this drug is a drug of choice. It could be inflammatory pathologies. Now we have mixed edema or edematous conditions where there is inflammation, which we call as raga and paka. Okay, so involvement of rakta is present, then Kaishara Guggulu can be very commonly used effectively. Vascular pathologies, again, this translates to Rakta Vrita Vata. The symptomatologies match exactly with what the vascular pathologists we see. So this corrects the arterial as well as the venous blood flow. So Kaishara Guggulu along with the other drugs. So that is the modality of treatment. So this is very beneficial in such conditions, and also in wounds, any wound condition where there is excess rakta dushti. In such conditions, Kaishara Guggulu would definitely be helpful. Okay, so the utility from simple acne, pimples or acne conditions where there is rakta dushti, repeated formation of acne. So we need to correct the rakta dhatu. In such conditions, also we can give Kaishara Guggulu, and even up to the extent of infertility, Kaishara Guggulu is used effectively. So there have been cases wherein there is arterial insufficiency, so there is lack of erection, there is erectile dysfunction. Okay, so erectile dysfunction occurs due to various reasons, one reason being the improper blood supply to the arteries of the penis. So even in such conditions, Kaishora guggulu usage along with other drugs is found to be beneficial. The patient on regular usage finds improvement sufficiently. So this is one of the indications. So what the text says, I have just picked up very few lines from the Palashrutis so that we don't have a repetition again. So here the line that I have picked is abhibhuya jaradosham karoti kaishorakam rupam. So jaradosha again, so senile conditions, the conditions of old age, in all such conditions we can use the Kaishora guggulu. So moving on to the next drug, Gandhaka rasayana. So Gandhaka rasayana, the main component is only Shuddha Gandhaka. Along with that, we have the bhavanas of many other drugs along to the given to the Gandhaka. So Kshira, Chaturjata, Guduchi, Triphala, Shunti, Artraka, Bringaraja. So all these dravyas, the kashaya and swarasa of these drugs, bhavana is done 8 times with each ingredient, and then sugar is supposed to be added in equal quantity. So here, one of the challenges we find in procuring the drug from the pharmacies is the number of bhavanas and basically even the shodhana for Gandhaka. So Shuddha Gandhaka, even though 3 times shodhana is prescribed as the minimum number of um, dhalana that is told, that is the purificatory step in Gandhaka Shodhana. Many pharmacies often do only one step of Shodhana. They to cut short the duration and also the resources, to reduce the resources, doing the Shodhana only once. So that is commonly used, whereas the even few pharmacies come with Shodhana of 8 times. So Ashta Guna Shodhita, Ashta Shodhita Gandhaka is also used in many of the brands. So selecting the Gandhaka with good Shodhana is one of the criteria while selecting a drug. And again, the number of bhavanas also. See, 8 times bhavana for all these drugs. So that has to be given compulsorily, but it takes a lot of time and the demand is in a large number. So we need the medicine, the supply has to be there. So what do people usually resort to is less number of bhavanas, so that they get the batch ready in as early as possible. So that would reduce the efficacy as well. Okay, so that we need to ensure which pharmacy we procure, how many times they are doing bhavana. The knowledge of this will give sufficient boost to our clinical practice. While now I may not be able to disclose or name any particular brands or pharmacies which give less number of bhavanas or which give the optimum required number of bhavanas, but this knowledge is definitely useful and this will be developing once we start the clinical practice using brands, medicines from different brands, see the results and then check the pharmacies, the reliability, etc., and then we will know. Okay, so then the next thing about Gandhaka Rasayana is the Srava Pradhana Pitta Kapha Vyadis. So Gandhaka Rasayana, so the main adhikara is the Kushta adhikara. In that specifically Srava Pradhana Pitta Kapha Vyadis, this Gandhaka Rasayana is going to be helpful. Not only that, even in Vrana conditions for Vrana Ropana and Shalakya Vyadis, Shirogata Rogas, Danta Rogas, etc., also Gandhaka Rasayana acts wonderfully in clinical practice. And there is one more precaution that has to be employed here. The text specifically says what has to be the pathya. The pathya ahara is something, kshira is something that is pathya here. And all the apatyas, that is kshara, amla, lavana, dvidala dhanyas, all the pulses and the shaka varga. So these are said to be the apathya. Pathya is all minus all these things. The other madhura, snigdha, aharas are the pathya, shashti, kashali, etc. So why this is told is, see, Gandhaka rasayana, any drug. So let me go in general. So whenever we speak about, increasing the dosage of any particular Ayurvedic drug for prolonged duration, one of the most common question from the patient would be, ಡಾಕ್ಟ್ರೇ ಈ ಔಷಧಿ ಹೀಟ್ ಆಗತ್ತಾ, ಇದು ಉಷ್ಣ ಆಗತ್ತಾ ಅಂತ. ಸೊ ದಿಸ್ ಇಸ್ ಮೀನ್ಸ್ the patient will ask whether they have, they get the symptoms of excessive heat in the body. So generally, properly planned treatment will not cause so. I'll tell you why. So if we advise the pathya, the drug would be acting, and also the other gunas. See, any drug. So Ayurvedic understanding, we have the rasa panchaka, rasa guna virya vipaka prabhava, etc. So suppose I am using a drug, okay, for its prabhava or its karma, and that drug is having ushna guna or ushna virya, so definitely it will cause increased heat or ushnata in the body. But we need to use it, suppose for its karma or prabhava, etc., or its other gunas. It could be ushna and lagu. It could be ushna and ruksha. Okay, it could be ushna and snigdha. So the other supporting gunas for which we are selecting ushna, a ushna drug could be anulomaka, and ushna drug could be shotahara. Likewise, many vyadi pratyanika dravyas, when we are using, it will give the tendency of increasing the ushnata or shitata, depending upon its rasa panchaka. Okay, so but we need its action, we need its karma, prabhava, and other gunas that has to be expressed. So what we have to do is we need to advise the pathya properly. If the patient also takes in ushna ahara, lavana yukta ahara, amla ahara, our medicine is also having ushna virya, definitely the person is going to end up with ushna complications. So whenever we are giving ushna virya dravyas, we need to ensure that the patient is well informed to reduce a little bit spicy food in their diet. So this is one of the common tip that I would like to give to the people, the students who are interested in clinical practice. Again, Gandhaka Rasana is also, as the name says, it is a rasayana dravya. So, dhatu kshayo titan rogan tata koshta samashritan pramehan shirsajan rogan shulam kushta adikanapi. So, here again, the text says about dhatu kshayo tita rogas. So, dhatu kshaya, again, another condition which could be occurring due to vranas or pittaja vyadis, etc., kushta vyadi, etc. So, in all such conditions, we need to incorporate Gandhaka Rasayana, which will give the benefit to the patient. Moving on to the next drug, Arogyavardhini rasa. So again, this again is one of the drugs that I commonly prescribe. So you can see from the chart here. So the almost half of this is Katuki. So the coloration showing brown, that is Katuki. Then the next is Chitraka. Next is Guggulu. Next, this is Shilajatu. This is Trifala, and these are all the other bhasma dravyas: Parada, Gandhaka, Loha, Abra, and Tamra bhasma. So these are the rasa dravyas. This is the maximum component being the Katuki. So this is the ratio wise main drug, whereas this proportion is one of the again main drug as well. So in Rasashastra we call this as Panchamrita of Rasashastra. It is Parada, Gandhaka, Loha, Abraka, and Tamra. So why this is called as Panchamrita, I won't go into a detailed explanation here, but we must know that this combination of these 5 rasa ingredients, they are a very good rasayana combination, and they are going to balance the doshas in a very ideal way. So that is why they are called as Panchamrita, and along with that we have the Katuki. So this drug is explained, this yoga is explained in Kushta Roga Adhikara. Obviously in Kushta Roga it can be given, but what is the understanding? So this is mainly useful in Rasa Rakta Medo Vikaras, Pitta Vrata Vata and Rakta Vrata Vata conditions. So Katuki is a Pitta Rechaka drug. Okay, so Pitta Rechaka drug we have with Gulu and Shilajatu and Chitraka. Okay, so again, so analyzing the combination, so this is something that will act on Dhatvagni and correct the Koshta and the Vaivarnya Pradhana Kushta. See, suppose there are certain conditions whenever the patient comes to a clinical practitioner, they will be either having the Vaivarnata symptoms or with itching symptoms, that is the Kandu. And another symptom would be like they already had the illness, but it aggravated suddenly, probably in winter or on intake of certain food articles. So we need to see what is the dosha, and the taratama bhavas of the Dushyas, and then prescribe the medicines accordingly. So one of the common changes on prescribing Arogyavardhini rasa is it could increase the srava, okay, and also it could also cause little uh, you know um, rechana activity, that is it could induce loose stools 1 or 2 times, stools um, expulsion, that is defecation, may be seen. So we need to know what it causes, so that we can advise the patient well in advance. Okay, so first, if there is a kushta patient, we need to understand whether it is a srava pradhana condition or a kandu pradhana condition, and then plan the treatment accordingly. So this can be commonly seen useful in uh, kandu kandu pradhana uh, and vaivaranya pradhana kushtas. Okay, so and the falashruti says mandala sevana is the kala, so about 40 to 45 days is the time period for its administration. So we have to be very clear in the prognosis of the disease as well. So we may not expect to administer the yoga and then expect results in 2 weeks or 10 days like that. So we need to be very clear, we need to tell the patient to be clear, this is going to help you out, but you need to follow patya and take the medicines, continue this medication for so on, so long, so many days. That is, the instructions should be very clear. And also one more utility is, as the name tells, Arogyavardhini. So the Palashruti gives a detailed hint about this. So Mala Shuddhi Kari Nityam Durdarsha Kshut Pravartini Pachani Deepani Patya Hridya Medo Vinashini. So it is the Mala Shuddha Karana. So whenever the koshta is affected, when Mala Sanchaya begins to happen at various levels, so Arogyavardhini in a lesser dosage for continuous time is definitely going to help the patient. Suppose we see patients who are in need of some type of shodhana, but there is balakshaya. Okay, in it could be old age, or it could be due to dhatukshaya. There is the bala has been reduced, and we cannot go for a shodhana. So in such conditions, Arogyavardhini rasa itself will act as mala shuddhikara, nityam mala shuddhikara has been told. So that is one of the utility. Okay, so going on to other yogas, I will just so see, one thing is I'm why I'm dealing with all this, the ratio, the proportion of the ingredients, and how to understand the utility in other diseases as well. So these yogas that I'm discussing are just an example, and one has to apply these methods to understand the formulations they wish to practice. So that will give a better hold on the formulations, and better results can be seen in the patients as well. So one such formulations would be Simhanada guggulu. So this is the proportion of the ingredients. Okay, so this green portion is eranda taila, almost half. Then we have guggulu, then Gandhaka, and then Trifala, that is Trifalaka in form of Kata. So this is the combinations. So only these many ingredients in Simhanada guggulu. So it is explained in Amamata Rogadikara. In Amamata, when do we use? So this may not be very effective in conditions where there is increased pain. So in very painful conditions, if we were to give Simhanada guggulu blindly, thinking that it is indicated in Amavata, this may not be of much use, because this does not have the Shulahara action. Okay, but definitely how it acts is, it acts by doing the Vata Anulomana, and also it has the Snigdha Anulomana property by virtue of Eranda Taila. It has Gandhaka and Guggulu, so which is going to do the Asti Dhatu correction, and Trifala, which is going to act on the Tridoshas and bring the doshas to a Samyavastha. So again, this again is indicated for Saumya Rogis, whose bala have been reduced, or who are taking many multiple medications. So in such conditions, this may help in increasing the bala, regulating the agni and the mala function. So what we say as samadosha samagnishta samadhatu malakriya. So Simhanada guggulu is one such formulation which will take care of this in a proper way. So again, one more thing that I would like to bring forth here, the pharmaceutical aspect. So eranda taila. So if I this is what the text says, this much proportion of eranda taila has to be there, but do we really have this much eranda taila in the medicines that we get in the counters of the pharmacies? I would say no, because if we all know that Simhanada guggulu is available in the form of tablets, right? So in the tablet form, if taila is this much, how do we make it into a tablet? This is definitely not possible. So pharmacies do not add this much taila because they cannot achieve it in a form of a tablet. If we add this much taila, it will be in the form of a leha, definitely in the form of a leha. And very rarely pharmacies produce this combination in the prescribed ratio. So air and thyla in the concentration, as mentioned, only then we will be seeing the desired results. Otherwise, if we are using whatever the medicines we get in the pharmacies, we have to supplement it with air and thyla extra. Additionally, prescription of Gandharvasta, the air and thyla or air and thyla as such has to be given. So this again could be a general prescriptions in senile conditions, old age, rasa rakta, mamsa gata, ama. So this is going to do the ama pachana in all the rasa rakta, mamsa adi dhatus and a rasayana. So etad abhyasa yogena jara palita nashanam amamatam jayed etadapi vaidya vivartitam. So this is the falashruti. Etad abhyasa yogena. So as I told you, etad abhyasa yogena. So by virtue of repeated usage or continuous usage, so the conditions of old age, see jara palita nashana, it may I don't have much experience or have not seen the observation of it reversing the old age or palita, the signs, graying of hair, falling of hair, etc. They may not be reversed absolutely by the usage of Simhanada guggulu, but what this term is hinting is it is going to act on old age conditions and keep them healthy. So one of the very most common complications or the conditions affecting people in old age is their mala vibandha, that is their constipation. They usually tend to resort to some form of laxatives. So almost many of the laxatives, whether it is herbal or non herbal, chemical based laxatives, they will form habit. The costa or the intestine would get accustomed to that laxative, and without the laxative the motions or the bowel movements would not happen. But whereas Simhanada guggulu is not such a drug, nor erand thaila is not a habit forming drug, and it also strengthens the other dhatus as well. So one can safely prescribe if any old age client or saumya rogi comes to us in our clinics. So again, another drug is Asanadi Gana Kashaya, that is very commonly used by me in my clinic practice. So the text says asana, the ingredients we know that asana tinesha burja shvetavaha prakiryaha kadira kadara bhandi shimshipa mesha shangyaha त्रिहि मतल पलाश झोंगक शाकशालौ प्रमुख धवक टिंग शाक पर्ण श्वकर्णः. So these are the ingredients. Apart from that, the knowledge of ingredients is definitely helpful, but this gana kashaya is one which is very commonly used in practice by many vaidyas. Being the reason is this is very useful in a wide range of disorders. The Palashruti says, Asanadir Vijayate Shvitra Kushtakapa Krimin Pandurogam Pramehancha Medo Dosha Nibarahanaha. So Medo Dosha Nibarahanaha. So Meda Pradoshadam Vyadis, and very commonly Kleda Pradana Kafaja Vyadis. This is very effective. So Srava, Kleda, okay, any conditions of affected by these are treated by Asanadi Kashaya. Okay, it could be simple staulya or prameha or vrana vidradi, etc. So in this photograph there is a depiction of a case where there is a case of cellulitis with srava and puya. So of course there have been various other medications used, but Asanadi Kashaya is one of the medications used here, and the srava and puya, kleda, etc. factors have been very effectively dissolved due to the continuous usage of Asanadi Kashaya here. So again, one more thing that we need to understand, whether we have to use the fresh kashaya or the bottled kashaya. So we get the kashaya in bottled form as well, but I would definitely suggest the fresh kashaya to be prepared by the consumer or the patient each day. So it is very simple. Inducing these practices in the patient is very simple. It is just like preparing a tea or a coffee. So they have to take one spoon or the required quantity of the kvata dravyas, which has to be given to the patient, and then ask them to add twice the quantity of water that kashaya has to be required, boil it with the Vata Dravya, reduce it to half, and then consume it. This is very effective. Commonly, I have practiced this in people with diabetes. Okay, so people come with a diagnosis of diabetes, so in which they have Kleda Pradhana conditions. Of course, the other aspects of the dosha and doshas have to be analyzed, but in general, if there is a diabetic patient, stoola patient, if we were to manage their glucose levels, so one simple habit that can be given is tell them to drink Asanadi kashaya instead of their tea or coffee. So that is very effective, and it is also one of the most commonly used ingredient in many of the patent drugs which are marketed for weight loss and diabetes. So they have this Asanadi Gana incorporated in many of the weight loss medicines for addressing Sthaulya and diabetes. So moving on to the next drug, Sutashekhara rasa. Okay, not much in detail here. Ingredients include Parada, Swarana, Gandhaka, and Vatsanaba, Datura, Trikatu, Shankabasma, Bilva, Kachura, etc. So this Rogadikara is Amla Pitta. Again, Pitta Vrata Vata conditions with Daha, Shula and Brahma conditions. This is very useful. The range of utility of Sutashekhara. So see this again from a simple gastritis up to migraine and even hemorrhoids. So see, one is the disorder of stomach, one is the migraine headache, and the other is a hemorrhoids. So in all these conditions, if we analyze the dosha, dosha, samprapti, nidana, etc., so we come to know that there is involvement of pitta avarana. So that how do we analyze that? Because of the symptoms. So in such conditions, if we incorporate Sutashekhara rasa in our prescriptions, we find very effective results. And apart from this, there are many variants. We have the Sutashekhara rasa plain, that is without the Swarna. Okay, and we also have something called as Lagu Sutashekhara rasa. In this, the Swarna is replaced by Swarna Gairika, which is said to have similar properties of Pitta Shamana. Nothing much of a rasayana, but Pitta Shamana activity is there. Then again, we have Shunti. See, if we see Sutashekhara rasa, we have many of the drugs that do the pachana of the Sama Pitta. Okay, like Tamra, like Shankabasma, Chaturjata, etc. So that whole set of drugs is represented by Shunti alone, and then we have Nagavalli Swarasa as Bhavana Dravya. So this Lagu Sutashekhara Rasa is one of the lighter versions, you can say, of Sutashekhara Rasa, which is easier to prepare, easier to manufacture, and it can be taken safely for a longer duration without much of the adverse reactions, if any, and also very cost effective. Okay, whereas we can choose Swarnayukta for Dirgha Kala Javyadis, for Gambhira Dhatu, and when we want to have the complete result, when we give the Sutashekhara rasa plain, and when the result is not up to the expected levels, or the patient needs a better result or output, then we can definitely go for Swarnayukta Sutashekhara rasa. Even Sutashekhara Potali is being prepared by many of the Rasa Vaidyas. This also can be used. Another yoga would be Kanchana guggulu. This is in Galaganda is the main indication. Of course, apart from that, any kapha, vata, medo mamsagata rogas, granthi, vidradi conditions, this can be effectively used. So to sum up, it can be effectively used in painless swellings. So clinical conditions can range from osteophytic changes, thyroid swellings, or symptoms of hypothyroidism without an evident thyroid swelling as well. Obesity, intestinal adhesions, benign and malignant tumors. See the range of Kanchana Gugulu. This can be understood only by the analysis of the yoga and the components. By simple, from simple obesity up to the intestinal adhesions or the benign tumors, malignant tumors, this yoga can be given. So in my clinic, I have used this effectively in patients of say obesity or even hypothyroid who come with a diagnosis of hypothyroidism, who are on thyronorm. So we usually give a course of shodhana, and after shodhana we reduce the medications of the thyronorm, the dosage, and then we give these medicines which are kapha medohara in nature. So with these medications, their dhatvagni will be corrected, their swellings, if at all, is going to get rectified, and their dependency on chemical based drugs would be reduced. And if at all the patient is advised with sufficient healthy patya and patya ahara vihara kramas, then even these medicines can definitely be withdrawn, stopped, tapered off, and the patient can maintain a very healthy lifestyle without even Ayurvedic medicines. So, and one more thing is, here the anupana that is told in the text is mundi kwata or kadirasara, or at the least patya kwata ushnodaka jala. So at least haritaki kashaya, any kashayam which is having the haritaki or triphala can be given, or ushnodaka at least. So these are some of the anupanas that the text says which are effective along with Kaishora guggulu. Okay, so one more medicine would be the rasnadi kashaya. So rasnadi kashaya is also clinically given in many conditions. So when I say rasnadi kashaya, there are multiple varieties or options, permutations and combinations available to us. Okay, so when we don't have a uh, availability of multiple formulations, any combination which has rasna can be given. But whereas when we have the option or the freedom to choose, then we can make a more pinpoint selection. So rasnadi kashayam, so that combination has mainly rasna dashamula and bhumyamalaki along with other drugs. So in cases of avaranajanya vata vyadis with pain, in that conditions this could be selected. Whereas Maharasnadi Kashayam, so it has Rasna Dashamula along with Bala, Ashwagandha, Shatavari, etc. So this is used in Dhatu Kshayaja conditions, Vata Vyadis with inflammation in specific. So that I can say as Shota Pradana along with Dhatu Kshaya. So in such conditions, Maharasnadi is effective. Rasna Saptaka, this combination has Guduchi and Aragvada along with Rasna. So this can be given in conditions where there is Koshtagata, Vata and Ama condition is present. In Rasna Eranda the Kashayam, we have the Eranda Sahachara that is added. So they will be doing the Anulomana, Vatahara and Rakta Dushti Hara as well. So this is just a framework or the methodology how to analyze the yogas and then apply them to the clinical practice when we have a various drugs available to our disposition. Other yogas, there are many yogas which we can understand in such a way. So as I told you, we need to select whether we have to use complex yogas, simpler yogas, or single herbs, multiple herbs, so on and so forth. We have various options, but it is always better we analyze the single component or the individual herb or dravya for its gunas and karma, and then understand the yoga. So that is definitely going to help our clinical practice. So in this way we have to understand triphala. So triphala is not just simple anulomana dravya or keshya etc like that. So it is also very useful as a rasayana in Koshtagata Vyadis. The ratio in which we use the Triphala, in what form we use the Anupana, these are all the conditions that are affecting the clinical outcome. Along with that, we have certain drugs like Sitopaladi and Talisadi Churna, which is commonly used. Here too, it appears that both are used, in similar conditions, but there is quite difference. So one such difference, like if I were to tell you, so in uh, in Talisadi Churnam, there is more of Kafahara drugs. In Sitopaladi Churna, it is more of you know Pittahara drugs. So in any systemic condition, Pittaja conditions, Sitopaladi Churna can be used. We commonly use this along with Madhu and Dvita in Kasashwasa conditions. But we can also use this with Jala Anupanam, with Kshira Anupanam, various other Anupanams for other Vyadis, and they also act. Sitopaladi Churna, I commonly also use it in conditions of headache, that is Shirashula, Pittaja Shirashula. So in such conditions, with Jalam, it is quite effective. Other yogas like Punarnava containing yogas, it could be Punarnava the Mandura, Punarnava the Guggulu, or just Punarnava. We need to see how it will act. So the combination is driven by the Pradhana Vyadi, definitely, no doubt. One more, as I told you about Asanadi Kashaya, similarly, Shadangapanya is also another drug that can be incorporated. See, many times in presentations of fever, we generally prescribe some fever, drugs, formulations for Jvara. But we seldom see the line of approach which the text speaks about. So Shadangapaniya is mentioned in very earlier stages in the Shastra, in the text of Jvara Chikitsa. So it is one of the drugs that commonly we can incorporate it, and not only Jvara. So again, Jvara is not fever. Jvara is something much beyond than fever. So whenever there is any sign of, any sign or any diagnosis that can be considered as Jvara, including the prescription or the usage of Shadangapaniya for regular usage, definitely is going to help, because the ingredients, look at the ingredients again: Musta, Prapata, Ushira, Chandana, Uditya, Nagara. So these, they have Amapachana drugs, they have, Agni Vardaka drugs, they have Pitta Shamana drugs. All this, it is going to do the Pitta Shamana, it is going to do the Amapachana, okay, it is going to do the Agni Deepana, it is Lagu, okay, and the dosage is very minimum. It can be used as a drink, and still the patient will be getting the effects of Aushadha. So that is one more thing. And similarly, Godanti Basma. So that is again one of the rasadravyas that is, very easy to process and affordable by the patients. So we can use Godanti Basma in combination with many of the other churnas like Avipattikara, Talisadi, etc. So what extra benefit Godanti Basma is going to give is, in conditions where Pitta Lakshanas are not getting reduced, so in addition to the other ingredients, if we add Godanti Basma, its efficacy is going to be much more improved. Similarly, Brihatvada Chintamani, Vasanta Kusumakara Rasa. So these Rasa Yogas, once we see that the simpler yogas are not acting as per our requirements, we can definitely incorporate these, looking at the various factors, the nature of the purity and the quality of the drug, and the affordability of the patient, and the Gambhirata of the Vyadi as well. Okay, see, suppose we see a very debilitated, patient, advising him the intake of Vasanta Kusumakara Rasa for a certain duration, definitely is going to help in Ojo Vriddhi and Uttara Dhatu. All the dhatus, it is going to get rejuvenated. Dhatu Poshana is going to take place, and the Ojo Vriddhi is going to happen, as the name says, Vasanta Kusumakara Rasa. So similarly, such Swarna Kalpas or any other complex Asaushadhis is going to act at a higher level. Moving on to, there are various other kalpanas in Rasa Shastra also, which may not be commonly used, but they are definitely effective. For example, Parpati Kalpanas. See, suppose there is a condition of Grahani or Koshtagata Vyadi, Vidradi, etc., wherein our regular medical prescriptions are not acting as per our desired outcome. Then when we incorporate those prescriptions along with the Parpati, any Rasa Parpati or Panchamrita Parpati, Swarna Parpati, depending upon the particular condition, definitely the outcome is going to be much quicker and better. So similarly, various other Rasa Yogas can be incorporated. So again, lastly, see, I have dealt with so many compound formulation, okay, and how to frame a yoga, or how to understand each particular formulation. I'll just give you example, taking one single drug out of the Samhita. Okay, how to understand each herb, each dravya in a yoga. So I would like to pick Yashti Madhu. Okay, we know that Yashti Madhu in Charaka, it is given in various contexts. So we know that Chardi Nigrahana Dashamani has Yashti Madhu. So okay, from this, okay, it is going to help in Chardi condition. Okay, then in Jwara context also, it is included among the Basti Dravyas. For Basti Karma, Yashti Madhu is the ingredient. So it is going to act on the Pitta, okay, in conditions of Jirna Jwara, etc. Please refer the particular Adhyayas to know the exact context. But I'm just enlisting what all common mentioning have been done in the Samhita. In Rakta Pitta, it is advised along with the Peya or as a Kashaya itself. So it is going to do the Rakta Pitta Hara action by Stambhana and Shita Virya. Okay, it is going to also, it is explained in Pandu Chikitsa as a part of Dhatri Avaleha. Okay, so this Avaleha is indicated in Pandu, in Pittaja Pandu, and in Kamala. So by virtue of its Pittahara Guna, this is helpful in even in Pandu conditions. In Pitta Vrata Vata Chikitsa as Seka in the form of Taila Grita Kshira in Vata Vyadi Adhyaya. So this can also be used as Seka. So why I picked these particular references? There are many, but why I picked this is you can give it in the form of basti, as a peya, as a kashaya, even as a seka, as an avaleha, etc. Okay. Again, in Vatarakta, a part of Yamaka Sneha, Yashtimadu is present. Okay. Again, Snehas can be prepared from Yashtimadu. Okay. Grita, Taila, Yamaka, whatever it is, Yashtimadu can also be processed and definitely helpful. And to end this, description about Yashtimadu, we may have commonly read in Rasayana Adhyaya, Medhya Rasayana, Shirena Yashtimadukasya Churnam. So along with Kshira, Yashtimadu Churna is going to act as a Medhya Rasayana. So see the spectrum of utility from Chardi Nigrahana to Medhya. Where is the utility going? See, just analyze from stopping the Chardi to the Medhya activity. We have to understand even further if we delve into the, gunas, into the rasa panchaka, everything will give the explanation for how this is going to act in each of these conditions. But here I am just highlighting the various wide spectrum of utility. It could be in the disease spectrum, or even in the spectrum of the form of utility. It is in the form of sneha, grita, avaleha, seka. Okay, likewise. So this is just an example. So like this we have to analyze each dravya, and then the yoga. Okay, so that is how we can become better in our clinic practice. So coming to an end, so whatever we go through in our theory, we have to bring it to practice, we have to bring it to the clinical usage. Only then, see, Ayurveda is going to take its rightful dignity in the society. Whatever said and done, swastha vritta palana definitely, no doubt, is one of the added advantage, but it does not stop there. Okay. Cosmetology, beauty therapies, rejuvenation, you know just abhyanga massage, centers, all those things are fine. It is not wrong, but it must, Ayurveda must not end there. Okay, Ayurveda must not end with your hair oil. Ayurveda must not end with your face pack. Ayurveda must not end with some massage. It must be extended, because when the text speaks about so many diseases, so many conditions, why are we not in a position to treat them effectively? Why are we not able to reach the public in addressing all these issues? We may not, in all the cases, we may not be able to manage them independently. We may have to we may need the support from the contemporary practice as well. So I am not against that, nor discounting that, but however we can contribute largely independently as well. So for that we need to know the repeated usage of these herbs, these dravyas, ekamulika prayoga. It could be the shamani gana dravyas, yogas, whatever it is, rasa shastra, rasa yogas, whatever it is, panchakarma, etc. But we have to use it on a repeated basis. Only then it becomes practice. And consistency, as the diagram or the picture is showing, consistency is the key. So there is one panchatantra story which says that if you dig, in different places, if you dig little in different places, you will not be able to make a well, you will not get the water. But if you dig deeper at a single place, definitely you will obtain the well or the water from the underground. So what this says is, don't just keep switching from one formulation or one herb to another. Stick to few herbs, stick to few yogas, see the results, then you will come to know its um, usage and its limitations. Then start using other yogas, extend it, get to know the ingredients, get to know the planning of the formulation. These are all actually secondary. The first and most important thing is analyzing the rogi and the roga. That is the proper diagnostic methods. Apart from that, the whole next aspect related to the aushadha prayoga, that has been, I have made an effort to address that issue. And along with that, keep looking at research, whatever research that is happening, keep looking at them, they will give new insights. Keep looking at patent medicines that are coming into the market. I'm not saying we must use them, but we must see what medicines are being in the market, being released in the market in the name of Ayurveda, the patent medicines, for what they are indicating it. So example I would like to say, so see, some formulation that is coming into the market for like diabetes or for hypertension. look at the yoga, look at the patent medicine, what dravyas it has, understand, then you will be knowing that even like, okay, so this herbs is beneficial, so what have they done, what research have they done, what combination have they put. So interesting, thinking will be unlocked. See, suppose there is an indication in our text referring to shota. Okay, some herb or some formulation is indicated in shota. What do we commonly think in our mind? We come to a conclusion that shota is some inflammation, some swelling, some swelling. Okay, definitely not. Shota is not some external swelling, it could be internal swelling as well. So shota could also mean something very common as an allergic rhinitis. We never consider allergic rhinitis as shota. So this, looking at patent medicines and the research they do is definitely helpful in understanding the, our dravyas, because we have come to a point where our understanding of the language in which the texts were written, the ideology, the mentality with which they have written this text, how they diagnosed. So there is a distance between them and what we are exposed to now. So definitely the modern methods or the modern language of research is going to help us bridge. We need not have to adopt them completely. We need not have to blindly follow that. We do not have to prescribe whatever the medicines they sell in the name of patent medicines for those same conditions for all the patients. But definitely analyzing them will make our practice in a better way. So keep learning and keep consistent efforts. That is what I would like to say. And with this presentation, I would like to also uh, express my gratitude to all my gurus and to all the preceptors of Ayurveda that have contributed in my understanding in some way or the other. With this, dhanyawada, thank you. So I come to the end of this presentation. So if there are any questions, we would be glad to clarify and you know answer them.
Thank you, sir. Sir, can you able to see the question, sir?
Yes, I'm seeing the questions now. Okay, so one question is, sir, please explain more on prameha as it has sita. Okay, so this is one of the common questions. See, when we see about any formulation, it could be, as I told you, Avipattikara churna or Chandraprabha vati. So many formulations which we use, okay, in a patient who is diagnosed with diabetes. Is it safe? Is the question. So see, these yogas have sita. So it is not just sugar. Okay, don't understand it as just sugar. That is like equivalent to adding sugar in your tea or in your food or something like that. No. So when sita is going to be given along with the other medicine, say with Avipattikara churna or Chandraprabha vati, I will take an example. See, Chandraprabha vati, in that it has sita. So in giving that in a patient of diabetes, okay, an allopathic doctor or a diabetologist would always advise the patient to reduce sugar, but we are giving a medicine which has sugar, okay, and it is effective. Okay, how it exactly acts, we have to study, we have to do a research on the biochemistry part. So we may not be in a position to explain how that sugar is going to go along with our Chandraprabhavati, where it is going to go, how it is going to act. But definitely it is not acting similar to what suppose a handful of sugar in the tea, it is not equivalent to a spoonful of Avipattikara churna or Chandraprabhavati. It is definitely acting in a different way. Okay, no doubt. It may be due to the combined action of the yoga. That is definitely sure. There is not, it is not a very big issue that we are having sita in formulations that are used in prameha or otherwise diagnosed as diabetes. That is very evidently seen in clinical practice. Okay. Next question is, sir, we all know about single dravya actions.
like how it acts. But I think when it comes to yoga, we lack how it acts in our body, its pharmacological action. Is there any books respective to this? See, there are multiple books. Okay, one thing is we have to see the patients, we have to give certain yogas based on their indications and analysis of their combination. So we cannot simply give any formulation, we have to analyze the combination based on its ingredients. Then we will get a rough idea. Okay, and then when we incorporated that in a particular vyadi, we know to what extent it acts. Okay, see, suppose there is a condition, there is a pittaja condition, there is karapada daha, I give avipattikara churna. Okay, so it may give just 30 to 40% changes or relief in a period of time, which is not matching with my expectation, or the vyadi in that particular rogi itself is has been there for a long time. So then what I do? Okay, I could probably add godanti basma with avipattikara churna. So that again is more pittahara. Okay, so that would be better. Okay, the patient would respond somewhat, but again, if some patient is not responding to that in an expected way, then we could add, say, brihat vata chintamani rasa. Likewise, see the ingredients. Okay, and coming to the books, how do we understand the pharmacological action? See, reading our samhitas in detail, lagutrayi included, okay, that will give a better understanding. Okay, we have to understand even aushadha sevana kala also matters sometimes. Not sometimes, most of the times it matters, but we are not competent enough to practice that way. So we are blindly giving tablets as 1 TID or 1 BD, 2 TID dosage. That is one of the reason is we are not able to give the prescribed dose. See, the text talks about karsha pramana dose, that is about 11 to 12 grams. So we are not able to digest that much of medicine effectively. None of us may be having that much strong agni. So what do? We divide that, or in lesser dosage per day. So if we give you know 500 mg tablets, 2 tablets TID, so it would amount to about 5 grams, something like that. So nearing the optimum dose we have to try to reach, keeping in mind the precautions to avoid any complications, that is all. So then we will definitely get the effect that the text says. And apart from that, understanding individual dravyas, see, extensive study or literature is available for individual dravyas, so that we must be thorough on. And then we develop our own understanding of the yogas. There are few books, Ayurveda Sara Sangraha, Beshaja Samhita, Rasendra, other Rasashastra books. Okay, so Rasashastra books will have some explanation regarding to the Rasa Yogas. Okay, so likewise Dravyaguna books, the 19th century, 20th century practitioners, they have given a lot of insight on these drugs. Okay, so reading those books apart from our Brihatrayi Lagutrayis will definitely help us in understanding and bridging the gap between our understanding and what the Samhita wants to convey. So that is the use. So usually, next question is, usually company medicine should use preservatives like sodium benzoate to maintain shelf life. Is there any negative impacts of these preservatives, either in short term or long term usage? See, one thing is, uh, research has shown that sodium benzoate in a particular concentration is safe for ingestion. Okay, so the concentration could be as less as 0.1 to 0.5 percentage. See, whenever we have a liter of kashayam, so there is probably about half a gram, 1 gram, that much of sodium benzoate that is added, so to preserve the kashaya. Okay, so when in that concentration, I would not say that it is actually harmful, but definitely it is going to have some action. Why do we say that avoid packed food? Generally any nutritionist, even current modern nutritionists are also saying this: avoid packed food, go for natural, cooked, home cooked meals. It is for the same reason that with the packed food you have a lot of processing, you have a lot of additives, preservatives, etc. So they do have some impact. They may not be harmful, but they also, on the long term may not be very beneficial. And there are ways in which we can avoid. So one such method I told, how to inculcate the habit of preparing kashayas at home, just like tea. Or we can use, you can formulate some other medicine like an asava arishta. The very concept of arishta came so that the kashayas can be preserved for a longer duration easily. Okay, so asava or arishta is one such kalpana in which this self-generated alcohol in a very limited quantity, that is about 5 to 8%, that will be acting as a natural preservative. But along with that, it is also giving its own medical utility, that is the vyavahi, vikasi, all those properties it is going to give. So definitely it is going to act also in that way, but it is a natural preservative as well. Apart from that, the vati, churna, etc. So wherever possible, try to look for alternatives unless until it is very necessary. Without anupana, which was said in respective yogas, can yoga act 100% if we prescribe efficiently, sir? Or anupana is must? See, we may not get the exact 100% result, definitely, but some result will be there because the yoga is being given. So here I would like to bring up one more topic which suffices here. See, whenever we give guggulu kalpas, most of the pharmacies, this was a research topic many years ago. Ayurveda scholars have done a research on how long it takes for a medicine to disintegrate in the stomach, to break down. For a medicine to be absorbed, first, whenever we give a tablet, it has to be, disintegrated. It has to dissolve in the liquid, or it has to get powdered, broken down in the stomach. So whenever guggulu kalpas were given, so it used to take a very long time, like say 1 hour, 2 hours, etc. And many times these guggulu kalpas would have got excreted as it is. So that was seen about 10-15 years back, and they have many pharmacies have made the necessary modifications. What they actually do is they prepare they do the guggulu shodhana, then they dry it, and then they make powder of it. Okay, guggulu powder is made, and then that is incorporated along with the churnas of other drugs, and the tablet is being made and given to, sold. So when guggulu is in the churna form, it gets broken down. But whereas when we prepare in the shastrokta vidhi, what we may actually have to do is we may have to take it with ushna jala anupana compulsorily. Or there is one more reference in few of the guggulu kalpas, that it has to be crushed and then taken. So whenever there is a vati, ideally, if whenever possible, it could be broken down, crushed either in the mouth or manually in a small kalva, then added with some liquid anupanas prescribed, and then consumed. The action will be better and quicker. There is no doubt. But of course, is it doable? That is a question mark. How much can we adopt it? That is a question mark. So wherever possible, we have to go for these practices in a shastrokta vidhi. Definitely we can get the results. Like in a village practice, when we give classical medicine, usually there are in loose form, so we have to give with some small brown covers. Like people even judge those medicines only cause they aren't in strip form. Okay, so you are like talking about the packaging method. Definitely, see, the packaging is definitely going to play a role. See, if you give the medicines in a loose way, that is, you pick few tablets and you give them the tablets, suppose for 1 week dosage, 2 week dosage. Earlier people used to accept, maybe in, as you said, in village conditions, probably they used to take them. But in a city based setup, so much so, leave alone strip, strip packing is, definitely it is a way that the medicines has to be neatly presented in an acceptable way, and also the dosage has to be standardized. Suppose like the medicine has to be, suppose a medicine is uh, say chitrakadi vati, maybe people will not use it continuously for a longer duration. In such yogas, there is strip packing, in which people can take 10 tablets. Medicines like Tribhuvana Kirtirasa, there is strip packing. So because very short duration the medicine is used and then it is stopped. Many other medicines, say guggulu kalpas or any of the other preparations, they have to be used for a minimum duration like 1 week or 15 days, 1 month, depending upon the condition. Definitely patient requires more number of medicines, so it comes in a bottle packing of 30 tablets, 60 tablets, 100 tablets likewise. So the bottle packing is a requirement. So the how the packaging is done, how the presentation is done, definitely plays a role in the preservation and also for the presentation aspect as well. In strip form, how to overcome these small practical difficulties. So strip packing, as I told you, the nature of packing depends on the medicine as well, for what it is indicated, how long it has to be used, all those things, and even the nature of the medicine itself. Suppose the medicine contains kshara dravyas, lavana dravyas in major proportions. So you cannot give those medicines in a paper baggage, in a paper cover, brown sheet paper cover, etc., like that. Because if you keep it in the open in a paper cover, it will melt because of the heat. So there has to be some sort of an insulation. So either strip packing or bottle packages are required. So those are all the applications that the pharma industry has been doing. Even when it comes to asavarishtas or kashayas, a brown or blackish tinted colored material is used so that the medicine is preserved for a longer duration. Likewise, even the tablets, uh, the bottles has to be of sufficient hardness. It cannot be a very thin, plastic cover like of a container, because when transporting itself, the tablet could break down. Many a times we see that in the bottles of medicine, these tablets become powdered. So it is essential that the tablets are in tablet form until we consume them at least, because the dosage will change. In place of 500 mg, it becomes 300 mg, 400 mg. It will not be as effective. So and it is also a wastage. Likewise, the packaging also plays a major role. In Dashamani, how we have to take those 10 drugs collectively as which dosha shamanas, or it can be given irrespective of dosha dominance. See, Dashamanis are explained in Sutrasthana, 4th chapter, right? So they are like a very basic guideline. They are told even before explaining the Samprapti, Lakshana, etc. Like Chardi Nigrahana, Dashamani you have, okay? Vayastapana Dashamani you have. So Shonidastapana Dashamani you have. So these are like, see, very commonly you are not able to diagnose, make a pinpoint diagnosis. Take all the drugs available, prepare a medicine, kashaya or churna or any kalpa, which is suitable, and then give it to the patient. That is for like a general advice. As and when you specialize, when you come to the chikitsa sthana, they have used specific herbs, specific dravyas for which type of condition. For vataja, you know uh, kasa, different herbs are there. For pittaja kasa, different herbs are there. Whereas kasahara dashamani, it's a common prescription. Likewise, so if you want very pinpoint action, your diagnosis has to be that pinpoint, and also the selection of dravyas will be very particular. Whereas if your diagnostic skills are, you know, uh, very basic, then you can give all the drugs very easily without much complications. But the result will probably take little lesser time to achieve probably. That is my understanding. But it can be given 10 drugs in a combination as well. Gandhaka rasayana can be used in ulcerative colitis as Vrana is in Koshta. Okay. So in ulcerative colitis, um, probably there are better choice of drugs available, which does the Vrana Ropana and the dosha as well. So once the Pitta dosha is sufficiently controlled, definitely we can go for Gandhaka rasayana. Gandhaka rasayana can be used. We have to just analyze the stage at which the vyadi is present. So that will make the prescription, better. Otherwise, in earlier stages, when there is still inflammation or conditions where easily like infections are there, if we give Gandhaka rasayana, we may just prolong the condition. Likewise, so just looking at the stage of the vyadi is very important, but it can be used. That is what I would like to say.
Thank you so much, sir. Your session is so enlightening for us. The way you thought about Yoga Karmukata framework of classical yogas with your own expertise and experience and insights to major and abundantly used classical yogas. Your simple and depth way of understanding subject and yogas made us to learn, improve and motivating too, sir. On behalf of Team Ayuryana, I extend my gratitude to our esteemed speaker. Thank you, sir. And huge regards and thanks to entire team of Ayuryana for organizing such thoughtful webinar. And I also thanks to Dr. Jaikumar sir for hosting today's session along with me. Thank you each and everyone.
Okay. Before we end, I would just like to express my gratitude to Team Ayuryana, and also as a last word, I would like to say that don't blindly follow whoever it is. Don't blindly follow even whatever I have said, what the prescriptions or yoga's indications that I have given out. Analyze, make your own understanding, apply this. See your guru's practice in person, get sufficient exposure, get the theory as well as practical knowledge, and then your experience will obviously get improved as you practice. Thank you one and all.
Thank you, sir.
Thank you, sir.